Women should know these 4 ovarian cancer symptoms. Ovarian cancer, as its name suggests, is a type of cancer that starts in the ovaries. There are 2 ovaries in a female reproductive system. The ovaries, albeit small, have a huge responsibility, which is to produce eggs and hormones including estrogen and progesterone. The thing about ovarian cancer is that it can be lurking in the dark. Often it goes undetected until you've experienced extreme symptoms as cancer spreads within the abdomen and pelvis. At this point, it'll be much harder to treat ovarian cancer. That's why it's crucial to detect it on its early stage, wherein the disease is still within the ovary, so it'll be more likely to be successfully treated. To educate yourself and save your life, stay tuned as we talk about the 4 symptoms of ovarian that you should be aware of. Number 1. Bloating. Have you had an unsettling feeling of fullness in your stomach? Sure, bloating is common since most women, if not all, have experienced this at least once. However, you should know that even something as mundane as bloating can be a telltale sign of a far more threatening disease. If it's around your monthly cycle and you feel bloated, that's normal, so don't worry. But if you have consistent bloating that goes on every day for up to 3 weeks, then it isn't normal at all. Persistent bloating is one of the most common early signs of ovarian cancer, which is often accompanied by visible stomach swelling called abdominal distension. Number 2. Constipation. Gastrointestinal or GI problems can be associated with everything from as simple as stress and anxiety to more concerning issues like irritable bowel syndrome and ovarian cancer. When it comes to GI symptoms, ovarian cancer often manifests itself through constipation. Therefore, you should pay close attention to any changes in your bowel habits. To be specific, be cautious if you have new constipation that doesn't go away by any interventions. Chances are this is another warning sign. Number 3. Prolonged pain. Have you experienced stubborn pressure in the pelvis and abdomen and/or lower back? Did it last for 1 to 3 weeks? If yes, then this could be an indicator of ovarian cancer. Albeit vague, prolonged pain, especially if it is new and doesn't just come and go, is likely attributed to serious illness. If the pain alleviates if you make some dietary changes, then it's likely a GI-related issue. That said, it can be difficult to set apart the symptoms of ovarian cancer and GI-related problems. So if you have these symptoms for prolonged periods and still doesn't go away after trying to cure them, don't hesitate to see a doctor. Number 4. Change in bladder function. More often than not, when people have urinary problems like being in pain when urinating, they usually point their fingers to urinary tract infection or UTI. In most cases, that could be the culprit. However, sometimes bladder-related problems can also signify a reproductive or gynecological problem, say ovarian cancer. If you have frequent needs to urinate, feel pressure or pain in the bladder, or have urgent needs to urinate, and they last more than several days, then that's a problem. For more thoughts and suggestions about ovarian cancer and how to detect it, our comment section is wide open for you. Feel free to drop your comments below.
If you like the video, give it a thumbs up and share it with your friends. For more interesting facts on the human body, subscribe to the channel.